Aloha gang, Dr. Russ Rosen here. What was it? There it is. Okay, it's showing live right now. Aloha, Dr. Russ Rosen here. Hopefully you're seeing this. I know there's that delay. Welcome to the OHC System Facebook community. Today we're talking about report of findings, which is such a critical piece of the puzzle. If you don't know me, Dr. Russ Rosen, I help natural healthcare providers like you thrive in a care versus scare true optimal health model. We're here 3 Tuesdays a month, 1:30 Pacific time. If you find value today, please let others know about this. It's free. If you'd like to dive deeper into subjects, you can put club below. I'll give you a free month into the club. Come and go as you like. And we go into just a whole lot more detail. And I don't lecture at you like this. It's in Zoom, so we can have a real life conversation and I can pull the best out of you. I'm going to go ahead and check and make sure it's actually showing that it's going live. 2 times ago, I thought it was, but it wasn't. So we're going to check. All right, there I am. Look at me right there, staring, trying to figure it out. Okay, fair enough. If you are there live, please go ahead and let me know who you are, where you're from. If you have questions as we go, let me know. I will get through the information and then I'll answer any and all questions. If you're watching this on a recording, put in the questions, I will answer. So today we're talking about the report of findings, and what I know for sure is that in a true optimal healthcare model, where we're not just trying to mask their symptoms or treat them till they're out of pain, but we're actually helping them get healthy, stay healthy, resolve their underlying issues, then most people are going to need more care than they're presently getting. And they're certainly going to need more care than they think when they come in. The odds are, if they were to stick around long enough under your care, that you could help them get better in ways that they could never have imagined. They can not only feel better, but we could also prevent problems in the future. We could reverse the effects of the aging process, or they could be healthier in 5 years than they are right now, and they could literally have a better life. So those are the things we talked about last time during the examination, that we help them understand that. And now in the report of findings, we're going to find out what it is that they actually want. Now, I know what your concerns are. When I speak with doctors, the most common things I hear is that people, they come in, they just want to get better as fast as possible, meaning feel better as fast as possible for as cheap as possible. I understand that. It's that way for all of us. Unless you've really set it up the way I recommend, so that you've got people who, you've clarified your niche market. You've got people coming in, they're actually wanting to get healthy and stay healthy. They recognize that it's a process. They're referring in their friends and family. They're coming to a series of talks, etc., etc. Then that's a different story. But for most of us, that's just simply the truth. Again, you recognize that people are going to need more care than they thought when they came in. And for many of us, that causes a lot of anxiety. And we get gun shy. We're gun shy in telling people the truth about what we know they need, because we've tried it before, and the people who used to sign up stopped signing up and our practice crashed. Or the headspace of, if I tell them the truth about what they actually need, they may not like me. They may reject me. They may think I'm trying to rip them off. They may think I'm all about the money, blah, blah, blah. Or it's a procedural issue. You feel fine about all that. You just have no idea how to do it. You have no idea how to present that. So, I see this all the time where people will, new one-on-one coaching clients will say, well, I normally recommend about 3 visits at a time. And I say, well, if somebody said to you, I trust you implicitly, I have all the money in the world, I have all the time in the world, I want to get everything you can offer me. I want to get the best results I can. What would you recommend for them? Assuming you cared about them and you loved them. It's probably more than you're recommending right now. I've seen doctors that go from being able to recommend 3 to a year of care for $12,500 and more. I don't care about the money. And I know you're thinking, well, I do. I don't care about the money, meaning I know that if you can get them to value it, they'll find the money. I've been doing this 25 years. I get stat sheets from all the doctors that I coach. When they're selling 3 visits at a time, their sign up rate is, let's say, 80%. When they go to a month, it's 80%. When they go to 3 months, it's 80%. When they go to a year, it's 80%. If we don't do it too far and tear your consciousness, it's too far out of your comfort zone, you're going to see it really isn't about the money. I get that it's hard to believe that when you're over here, but once you're on this other side, you get that it's true. Okay, so 3 parts of the report of findings. They break it down into 3 parts. The first part is you got to make sure their head is back in the game and we review information from last time. So remember in the exam, we're not going to go through information that they don't understand so we can explain it in the report of findings. They understand it. They get what's going on during the exam. We just now need to review that, get their head back in the game. They went home, chop wood, carry water, change diapers, help with, homework, talk to in-laws. And we got to get their head back in the game. So it's quick review, only takes a couple of minutes. And we're going over the information from last time. The second part is we need to find out what they want in relationship to what we can truly do for them. Now, if you've listened to other things I talk about, I'm always talking about this. This is what they come in thinking, oops, you can do for them. I can feel better. -10 is near death. 0 is comfortable. I feel good, but I'm not functioning at my optimum. 10 is I'm as healthy as I can be. I'm functioning at my optimum. So the reality is they come in thinking you can do this for them. It's your job to let them know what you can truly do for them. Okay, what you can truly do for them, what just adjusting would do for them, what adjusting in specific nutrients would do for them, what that in brain-based work would do for them, neurofeedback would do for them, homeopathy would do for them, acupuncture would do for them, whatever it is you do, it's your job. You owe it to them, from my perspective, to let them know the truth about what you can do for them. It's their job to choose what they want. Okay? So, and I'll give you access to this if you like in the club. So if you want, just put club below and I'll give you access. You can go there and get this and print out as many as you like forever. Okay, so the third part, and we're going to go over this today, and the third part of it is you got to go through their care plan. Now, obviously, it's a huge piece of the puzzle, being able to recommend a care plan, understanding the neuroscience of communication, so you do it in a way that doesn't blow them out of the water. A lot of information. If you do it right, what I see is that over 80% of the people should be choosing the largest plan you recommend. Whatever you think would be best for them, assuming they say, I want to get healthy and stay healthy. Obviously, if they're saying, I just want to feel better, that would be a different plan. But if they want to get healthy and stay healthy, whatever you think would be best for them, I want to see 80% choose that. The next plan, I want to see 10 to 15%, 10 to 20%. And then, depending on if they've already been to a talk first, if they've already been to a talk, no one's not going to sign up for care. It's just not, it rarely ever happens. But if they haven't already been to a talk, maybe 5% won't be choosing any care. Some might be choosing pay per visit if you offer that. A lot of docs I coach don't. And then there's a small plan and a big plan. So those are the kind of numbers I expect to see if you're doing all the things that I'm talking about and recommending. It's not hit and miss. It is by design. Now, remember, in the examination, they said out loud, again, if you want this, go into the club, you can get access to it. They said out loud, I know, and I'm going to say this as if it's a chiropractor doing subluxation-based chiropractic. If you're doing brain-based, you would use that word. If you're doing acupuncture, you would use that. Nutrition, you would do that. I'm just going to say subluxation. I need them to say out loud, when I review their tests with them, I know where my subluxations are. Remember, they circled those. I know that could be causing these symptoms. They circled and underlined those. My headaches, my sinus problems, my mid-back pain, my indigestion, my coated tongue, stinky armpits, explosive diarrhea, sciatica, right? I know that this is where they are. I know this is what it could be causing. I know what probably brought them on in the first place. I know what happens if I don't get it taken care of. I know what happens if I do feel better, prevent problems, reverse the effects of the aging process, or be healthier in 5 years than I am right now, and I can have a better life. I know that this is a health problem, not a back problem. If you don't get them to that place, you have no business giving a report of findings, as far as I am concerned. They need to know this. Okay, so let's assume we've got them here. Now, we do the classic, we're going to go over 4 things. What's going on? Can we help? How long will it take? And what will it cost? You do the first 2. Now it's how long will it take? Well, before I can tell you how long it will take, we need to clarify what it is. And that's why I walk them through this. So -10 means near death. And thank God that's not you. 0, assuming that's true. 0 means you're comfortable. You feel good, but you're not functioning at your optimum. The test we just did would not be clear, but you feel good. And then +10 is you're as healthy as you can be. You're as healthy as we'll be able to get you. And we would know it because these tests are going to be clear, or they'll be as clear as we can get them. Okay? So I need to help them understand this. I need to find out where they think they're at. Most people would be below here because they have some symptoms. Where do they want to get to? The vast majority, if you do your consult and your examination right, the vast majority of people, like over 90%, will want to get to here. I want to know how long they think it will take to get here, right? They understand, which way does this go? They understand what caused them to come down here, right? Crack cocaine, sold to the circus, raised by wolves, right? So, shot out of a cannon. These are the things that caused me to go down here. I think I'm here. I'd like to get to there. I recognize it'll take a year or 2 or more to get there. I am this motivated to get there. As far as what do I think I need to do to get there, address my subluxations, eat better, exercise, deal with stress, etc. And what would I hope for? Like, obviously, they want to feel better. I get that, but what else? Right? Would they like more energy, more clarity, better digestions, leap tall buildings in a single bound? So I need to stretch their consciousness of what they can hope for as they're getting healthier. So I want you to think about this and think about how important it is for them to tell you, not for you to tell them where they're at. Now, obviously, if they're wrong, we have ways of fixing that. But if you tell them, if you understand the neuroscience of communications, it's very different than if they tell you. So how important it is for them to say, I think I'm here. I would like to get to here. I recognize it would take this long. I'm super motivated to get there. I recognize I need to do these things. I need to get under your care. Crack subluxations, clear up the congested chi, get the brain balanced, whatever it is that you do. And then these are the things that I can hope for. So I hope that you see how important that is. Thursday, 11 a.m. Pacific time, we'll be diving into this in the club. If you can't make it, don't worry, record it and I send it out. But if you can make it, we're actually going to be on Zoom talking to you about this and how you practice and the specific words you would use and how we deal with the challenges, right? They think they're here, but they're there. They think it would take a week, but it would take a year. So we're going to handle all of that in the club. If you find value in this and you would like to know more, put club below. I'll go ahead and send you a link for a free month. And of course, you can download this and all these other things. If you know other people that you think would find value in this, would you please let them know? This class right here is free, and I'm hoping you find value in it. I'm going to go ahead and check below. If you have any questions, I'm hoping you will let me know. Okay, no one's posted any questions. So hope you found value. As always, much love and aloha. Bye, gang.